Businesses across the country will soon be able to access free rapid tests. Today, the Prime Minister announced employers can get rapid tests through a new federal web portal.
Supporting businesses, organizations, and the public sector in accessing rapid tests is key to identifying and isolating cases and therefore reducing the risk of further outbreaks. That's why we're making it even easier for everyone to access these tests. In Ontario, small and medium-sized businesses and organizations can now get rapid tests at over 40 Shoppers Drug Mart locations. Additional distribution locations and pharmacies will be added soon. Testing works.
The Canadian Chamber of Commerce is helping distribute the tests, and Perrin Beatty is the president and the CEO of the Chamber of Commerce, and he joins me from Ottawa. Mr. Beatty, thanks for doing this.
Thanks for having me.
I wonder if you can walk me through how you see this working. There's a federal web portal where people can ask for a rapid test. What happens after that?
Our focus is going to be on SMEs across the country and any jurisdiction, any province or territory which doesn't put impediments in the way to the distribution and use of these rapid tests. And what we'll be doing is working with provincial and with local chambers of commerce from across the country to have supplies in local communities that local businesses can apply for. And they'll be applying through their local chamber of commerce. Now, the key here, though, is what I mentioned earlier. In most of the provinces across the country, there are still impediments here where provincial governments require that the people administering the test have medical training. This makes no sense whatsoever. In Britain, these tests are being given out, sent directly to people's homes, with people being encouraged to administer themselves. And they don't require a great deal of training. If provincial governments can remove that, instead of taking people away from where they're needed in the healthcare system, what we can do is have businesses and others administering the tests, rolling them out, helping to save lives and helping to save businesses.
Well, I wanted to pick up on that point because the federal government has bought a lot of these things, right? Because a lot of premiers started asking for them. It's calling them a game changer.
40 million.
Right, and they've sent them out to a lot of the provinces, but in a lot of cases are just sitting there and haven't been used. And you touched on the fact that some provinces require the test to be administered by a trained health professional, and that becomes the obvious bottleneck. I mean, how optimistic are you that you're going to be able to get through that to allow for this more widespread use of these rapid tests?
Ontario and Alberta are leading the way and saying that they have changed their regulations to allow for people without medical training, but people who've had a chance to see how the test should be properly administered would be able to do so. We're hoping that other provinces will do so as well, because we certainly have chambers right across the country and communities from coast to coast anxious to make these kits available free of charge to businesses. And you can see the importance of that, where workers coming in can be more confident that it's safe for them to do it, that customers coming in can be more confident, and that the focus of this is on people who are asymptomatic. It means that where these kits can identify someone as having the disease, even before they show the symptoms, this will help to save the spread of the infection and help to save lives.
So if you get your way and say every province and every territory says, okay, go for it. We'll put these in businesses and we'll let someone who's designated to handle the test kits do it in the business. Who do you envision being tested here? Is this for the workforce? Is it for customers or both? Or does it vary from jurisdiction to jurisdiction?
The priority is the workforce. Mm-hmm. For people wanting to come back to work, they want to know that it's safe to come back to their place of work. And for customers coming in, they want to know that it's safe as well. We've had a pilot program up and running now for a few weeks in Kitchener-Waterloo and in Cambridge. And within the first 2 weeks, 1,000 businesses in the region of Waterloo applied for this. And some 50,000 kits, or 60,000, I believe, were actually committed. The demand for this is enormous, and what the chambers there have heard is businesses saying, this gives me the first hope that I've had, that I'll be able to do more to protect my employees and my customers and to keep my business open.
So what impact do you see this having if it goes ahead? Like, how much more will we be able to reopen? Because still, the view and the advice from a lot of the medical professionals and experts in the country is that, especially now with a third wave, keep it locked down, keep it tight. wait for the vaccines to catch up. I mean, so how do you see the interplay of restrictions, vaccination, and then rapid tests?
Ultimately, it will be only vaccination that will allow us to defeat the disease. So we have to have two plans. One is, what do we do when we reach herd immunity? How do we reopen then? But the other is, how do we manage it between now and the time when we hit herd immunity, when people are vaccinated? How do we keep people safe? And how do we keep the economy functioning? And this is one more layer of protection that we can put on, along with masks, other PPEs, safety protocols, the COVID app, vaccination, and others to help keep people safe.
So you say Ontario and Alberta are leading the way on this. Where are you in conversations with other provinces, right? Like the Atlantic provinces, when they've had their outbreaks, have used rapid tests to sort of do mass community testing to try to get things under control and try to stop spread. But I don't think they've deployed it in any consequential way in business settings as a regular routine thing. So outside of Ontario and Alberta, with two business-friendly conservative premiers, where are you with everyone else?
What we have is the Chambers of Commerce presidents of the provincial Chambers of Commerce and territorial across the country are each approaching their provincial governments and saying, we would like you to take part in this program. The kits will be available free. We will help to distribute them to SMEs. This will help us to save lives. There's interest, for example, in Halifax from the Chamber of Commerce there. Right across the country, we're hearing from chambers, Saskatoon as an example. And Regina, they would like to be able to distribute this and to help SMEs in their community, but they need the collaboration of the provincial government to do it.
Scott Moe seems like a premier, though, who would get on board with this, would he not? I mean, are you having any luck in Saskatchewan? I mean, if Regina's on board, Scott Moe doesn't seem like a guy who'd be hard to convince to do something like this.
To me, it's a no-brainer. If you can save lives, if you can rebuild business confidence, if you can help to save businesses, and if it's free of charge to the provinces and to the businesses involved, it's a pretty easy decision to make. And we're anxious to see recalcitrant provincial governments of whatever political stripe come on board as rapidly as possible.
Okay, Perrin Beatty, we're going to leave it there. Thank you so much for your time.
Thank you.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.